people highly educated, well-traveled, they don't want medication. Doc, is there any way I can go off this medication? That's the
Yes.
first thing they ask. Okay,
Yes.
that itself shows the awareness. Actually, they feel that they can go off medications thanks to lifestyle medicine, PCR.
Yeah, leading by example is the best thing one can do. So it really helps a lot. Do you find the adoption to a plant-based lifestyle? I mean, I think you kind of talked about it in some of your patients that they were very resistant in adopting it. But do you find it easier these days rather than maybe a few years ago?
Yes, actually, overall, I would address this in a total, the whole context actually, because initially when I started in 2012 as a small, this thing set up to help people, from there, starting IOH in 2015, and now if you take, there were only less than 1% of the people who think that lifestyle can change their health. Okay.
Yeah.
But now, 2015 to now, if you see that everybody, like people highly educated, well-traveled, they don't want medication. Doc, is there any way I can go off this medication? That's the first thing they ask. Okay.
Yes.
That itself shows the awareness, actually. They feel that they can go off medications. Thanks to lifestyle medicine, PCR and Dr. Tripathi or whoever is impacting India. And you guys, the latest edition. It's wonderful, actually. So then next thing is when it comes to changing the plant-based to a plant-based eating pattern, as I mentioned, I do that in a basic approach. India being a very highly sensitive to cultural eating patterns, anybody for that matter. So addressing that in a very sensible manner, empathizing with them with their issues and dynamics of life and things like that. And if you ask, just like a physician, if you ask them to completely go off milk, completely go off your this thing, that doesn't work actually. So you need to have a basic approach, bringing them to a thing. It takes at least 2 months to completely cut down on milk, and they feel that without milk I get my bones get weak, I get this, I get that, and all. Actually, a lot of these misconceptions are there. Second is, so that actually takes time for them to really understand. Currently, we have well-educated, well-aware people in our group, but we are also getting into lowest rate of the educated, so people who doesn't understand really the science of it in a different way. So I'm sure that we will get there actually soon. So next is actually coming to plant-based eating pattern. Over the last 4-5 years, if you see that, if you ask them to go off milk, they're able to do it because there are a lot of these plant-based products available. So that's a beautiful thing actually. And tofu and tempeh has become a part of my clients' meal every day now.
Every day, yes.
That is, that actually the plant-based industry shaping up is a huge boost to the lifestyle medicine practice. We can easily ask them to do this shift actually. It was not there 2012, 13 and all. It was very difficult.
Yeah, we've noticed, before we moved to India, it used to be so difficult to find milk alternatives and tofu in general. And now, even actually since we moved here,
even in the last 2 years, we've noticed a difference.
I remember being sad that there was no tempeh for me to eat. And now I have choices in my tempeh products. So it's definitely, it's great. Speaking of food, sorry, go ahead.
Yeah, I totally agree with you. The last 2 years have really tremendously transformed the food industry in India because, milk was, that way pandemic has given a good edge actually, a great edge because, people were going off meat and other products because they feel that that's also a reason. And then all these tempeh, tofu and other plant-based stuff has really taken up actually. That's a great transformation happened actually.
Yeah. Because if you don't, if you just simply I think you kind of mentioned this, but I'm just kind of repeating it myself. Maybe am I repeating you? Which is, you can't just simply say, stop this, stop this, stop this. They'll say, what am I supposed to do? What am I supposed to eat? What am I supposed to drink? Now, at least we can say, stop this, but we will give you an alternate that is just as tasty, if not tastier, and here it is, whatever it is, So, sorry, you were saying something interesting.
Yeah,
No.
Jenny was saying something.
Yeah, this is my favorite question to ask on the podcast is what is your favorite plant-based meal to prepare and or eat?
So, I have few of them actually. One of them is the burrito bowl in a plant-based manner with black bean. Black bean is available in Amazon. It's expensive. It's 460 or something, but it's one of the best. It's one of the best one. Me and my family love it. Actually, we make rolls, roti rolls with it, with a lot of different vegetables, including mushroom, broccoli, onion, tomato. Then tempeh or tofu sometimes. It's a beautiful meal actually. Or the burrito rice bowl, we make it with that. Second one is my seed pudding. Seed pudding, we have different varieties. I have a lot of pictures of them. That is something which I like. And, these two are my favorites. Overnight oats bowl, which is another favorite. Yes. And my daughter's favorite is a sushi. A vegan sushi. She keeps making it every day. Again, actually, I feel that we need to make it little more affordable. It's 600 rupees for a kg. Yeah. But, we can actually... Sushi rice. But, we can always... A lot of my clients are actually, initially when they are shifting to a legume-based protein meal, actually, they face problems because they feel gastritis, gaseous distension, these kind of things, But, like when I see a plate with 1/4 of the plate with the legume portion, different legumes coming into the picture, that's aha moment, something like,
Yes, very true. So very true. I mean, I think... Go ahead.
Yeah, what's your favorite vegan dish?
Oh gosh, yeah, I also have a few. I mean, we during lockdown, I guess I've been experimenting more with things. So I guess a family favorite is I make a Hyderabadi chicken biryani with I make my own seitan at home. So that's that. And then the kids love vegan mac and cheese that we make with the cheese is like potato and carrot and turmeric and cashew. We spent a lot of money on cashews in this house. But it's been fun kind of, and I'm sure you've noticed this with your daughter, veganizing like kid favorites.
Oh, wow.
And also, actually, that kind of leads me to mind. I wanted to ask you about having a vegan child, just if you've had any, I don't want to say pushback, but like with our two boys who are 99% vegan, sometimes other parents comment, how can you not give them milk? Or when, kind of at school when they're the difficulty with eating a vegan diet at school and at parties and that sort of thing. So just wondering if you had any thoughts on that.
Lots. Same thing actually, like even both her grandparents, sometimes I feel that they're trying to make her understand that you need to be moderate in your choices and things like that and all. And one day I was overhearing my daughter speaking to my mother, you don't know anything about what's happening in the world, you don't know the climate change, this, that. And then wow. She was also like one day she came sad from school and actually there was some program or some discussion about some poem that humans are destroying animals, environment and things like that, and she started talking a lot about it. And like we are always very exploitative. We don't allow anybody else, we want everything to ourselves. And she started off actually with all those stuff, and then people started telling her that she is some vegan teacher in TikTok or something. It's very annoying. So then she came back home, and then they were asking about the proteins, a lot of stuff. So I told that, we can actually make people understand what it is. Then we did a video that particular day and put that in the school group, actually.
Oh, nice.
So we do a lot of such things, actually. People think that, they told her that, she told that, I'm having a lot of legumes and tofu, tempeh and all. I have enough protein. So I feel healthy and energetic and all. So then they also wanted, more proof you ask your mother kind of a thing, like then we did that actually. People think also when I was in the early years, when I turned vegan, when I was having a family dinner at my cousin's place, they were all asking me, no, you may get into a nutritional deficiency, this, that, and all actually. So my husband got in.
Yeah.
Sometimes, like in a family thing and all, I don't want to appear like a very annoying and irritating person. So I told that
Right.
I did a conscious decision. Yes, conscious decision.
Yeah.
Then my husband got involved and told, you don't know, she is one of the expert in the field. She scored the first in net exam, so don't have to listen. Then they all, now they all actually take my guidance. Okay, after 4 years,
good. I'm very happy. Very happy to see. Yeah. So in our case also, I mean, one of the things that when we are invited to parties, we don't actively, we are vegan or something like that. What we do is we just say, if whatever you have, whatever you're serving, we will make sure that we can get enough. If there is dal, roti, chawal, and some sabzi, that's all that we need, right? So we don't tell them, don't do this, don't do that. We just keep our mouth shut and go there and enjoy ourselves,
And we bring secret vegan dishes.
Yeah, that's right. So she makes this like chicken, the seitan chicken, and she will make some, like a Assamese dish or Nepali dish or something like that, and we take it there and we say, well, we brought something for you, and then they eat it, and then we tell them that's actually not vegetarian. That's not non-veg. It's actually
they will
vegetarian,
not believe.
and yeah, and then they like it, and then they say, "Oh my God, we need."
And then they want more.
They want more, so then they come over to have it. So yeah, it works out great because I think it's. I'm so happy. I'm sure you also have hardcore meat eaters that they come to your house, maybe eat vegan stuff, and then they go home and eat meat. But then, at least we have noticed in our own family, they're eating less and less meat.
Yes,
in their house.
Yes.
Yeah,
there is a huge change which is happening. I totally agree with you. Actually, there is a shift happening with people. Like for me, actually, initial years of turning vegan, when I went to Kerala, I had to really try my mother-in-law's fish curry, the curry part, not the fish, because she made it with so much of love and ignoring that was not
exactly.
Like something. But after that, now what's happening is my mother-in-law calls a cook who can do vegetarian cooking when we go there.
Oh, wow. Amazing.
Yes,
that's nice.
That's a huge thing.
Yeah.
When she was here, she kept telling that I don't eat meat much. She doesn't eat most of these things. Even my parents are actually reducing the quantity of these stuff. Very rarely. Once in a month or something.
Yeah. So I mean that, and we always tell people if you look at the blue zones. I mean, we start by telling, especially the meat eaters, we start by telling them about that and say, like if you go not today, maybe 15, 20 years ago, if you went to Okinawa, they are meat eaters, but yet they live up to 900 years. Why? Because they eat meat like this big once every 2-3 weeks. The rest of the time they're eating sweet potatoes and rice, and they're very happy with their lives and healthy. So we don't say, oh, stop eating meat entirely. I mean, if you feel that you want to eat it, that's fine. But when you cut it down drastically, the faster and more you cut it down, the better you see your health improve.
Eat mostly plants.
Yeah, and one of our favorite sayings is mostly plants, not something made in one. Can you talk to us, Dr. Rajeena, about your future plans? I mean, what are your thoughts in terms of the next few years? Where do you see this movement as well as your own practice going?
Yeah, actually, it's a very good question because, like I've been in this industry from 2012 or so, in fact, in 2008 onwards, I was actually involved with the more of health optimization, but 2012 onwards, exclusively doing this. So what I see is there is a huge transition which happened in healthcare. At least people are wanting to going off medication, wanting to check alternative evidence-based modalities of treatment is a huge shift which is happening. But it's like, as I mentioned, it's happening with the early adopters, which is like that top less than 10%. I'm sure that will come will become a movement in no time. During this time, because IOH we started in 2015, the idea was to, have a system, a platform for doctors and other physicians and other people to guide their patients using a platform so that they don't have to look for resources everywhere, right? So that was the idea. But what happened is actually didn't click because of multiple reasons. One of the reasons was the industry itself was not ready, just escaping up. So what I wanted to do the next is actually impact the healthcare field itself, about the alternative evidence-based modalities of treatment with respect to changing lifestyle and dietary pattern and things like that. If you go to a med school, I was having a discussion with some of the medical students, a few of the medical students in different things. So really, I really understood that they really don't know anything other than procedures and pharmaceutical agents.
Yes, it's all interventional. Preventative is just not in their paradigm.
At nothing. Yeah. So then I really understood there is where our focus should be. We need to have the kind of things happening at the core of the healthcare level, actually. I don't know whether we'll be able to make huge changes in the practicing doctors, especially 35 and all, actually. Huge change will not be possible. But the younger ones are ready to take anything new. So that actually is what is going to change the healthcare paradigm or the landscape, actually. So that's what I'm going to be focusing on the next few years, so that, the healthcare system itself start realizing that there is something better modalities of treatment. Better modalities of treatment not only give rise to better health, but also better planet, better ecosystems, we all live in harmony with each other rather than just getting in. So that is something which I'm focusing on right now, and maybe a few years down the line, I really want to scale up IOH. That is not in the agenda right now.
It's great goals to have. I think you're absolutely right in the sense that, if you focus on the younger generation that's coming out of the medical school, and, we won't bore you with our story about it, but I think you're absolutely on the right track. Making them understand it will bring a sea swell of changes that everybody's going to be aware that, yes, there is this new branch called lifestyle medicine, and yes, somebody can specialize in it, and yes, it can take care of chronic diseases. So that kind of an awareness, if we bring forth, there'll be many more people talking about, rather than just somebody saying, here's a pill, take it and try to fix yourself and come back when when I'll probably increase the dosage, I think, you're absolutely right. So one last question before I let you go is, how can people find you? I mean, I know this is an era of social media and so on and so forth. So, Insta handle or YouTube, whatever it is, Facebook or your phone number or email address or the company site. What's the best way to get in touch with you for our listeners or anybody to make contact?
Yeah, basically, I think the first and foremost is listening to me is one part of the story, but I think listening and knowing a lot about the content out there in the field of this therapeutic lifestyle intervention is the first step they should be doing. And if they really, like, a lot of these things can be done when you follow these guidances, which is given out by most of these experts in the field, including Jenny and Ajoy. You can definitely contact me. My number is 988093279, or email ID Rajeena, RAJEENA, Rajeena.Shahin @gmail.com. Yeah, that should be enough. There are a lot of lifestyle physicians out there who can guide you. You can, check a lot of, I also suggest checking some of these sites like lifestylemedicine.org. Even PAN is coming with a huge agenda of changing the education segment in India, medical education segment in India. PAN site is pan-int international.org. That also is something which you can check. Also, these medical students, whoever is listening to this, please check out these sites and learn what's happening in the world of medicine.
Thank you so much for your time. and all the best for the future. And I'm sure we'll be crossing paths, and maybe we can, if there is enough demand, perhaps we can have you again to talk about specific instances or specific cases or specific interventions, lifestyle interventions that we can discuss. Be it exercise or diet or whatever it is. That'd be helpful.
Sure,
Thank you.
Definitely,
Thank you so much.
Anytime. Welcome.
All right, thanks.
Bye.
We really hope you enjoyed our conversation. Can you think about one thing or an idea that you can start to introduce into your own life that will help make your life healthier and less stressful?
If you enjoyed today's episode, we'd really appreciate it if you could take a few seconds to share the podcast with your friends and family. Thank you so much for listening. Have a wonderful week.
And always remember, your health is literally in your own hands. Making lifestyle changes is not an easy task, but we promise you will be aptly rewarded with a long, healthy, and disease-free life.